All right, wonderful students. Now we're going to take a look at drugs affecting our GI secretions or gastrointestinal secretions. Peptic ulcer disease is a condition in which painful sores or ulcers develop in the lining of the stomach or the first part of the small intestine or duodenum. Normally, a thick layer of mucus protects the stomach lining from the effects of its digestive juices. But mainly things can reduce this protective layer, allowing stomach acid to damage the tissue. There are many things that can do that. Many causes of peptic ulcer disease develop because a bacterial infection caused H. pylori or Helicobacter pylori. This bacteria eats away the protective lining of the digestive system, thus allowing the acid in the stomach to eat away at the stomach tissue. Also, patients who frequently take pain relievers like NSAIDs, non-steroidal anti-inflammatory drugs, or steroids are more likely to develop ulcers, and in some rare cases, being seriously ill from various infections or diseases can also increase a person's risk for developing peptic ulcers. Some risk factors for ulcers include frequent use of non-steroidal anti-inflammatory drugs or NSAIDs. It could include a family history of ulcers. It could include illnesses such as liver, kidney, or lung disease. Regular drinking alcohol. It could include regular smoking. It's a common misconception that coffee and spicy foods can cause ulcers. They cannot. In the past, you might have heard that people with ulcers should eat a bland diet. But now we know that if you have an ulcer, you can still enjoy whatever foods you choose as long as they don't make your symptoms worse. So some people will be totally fine eating spicy foods and drinking coffee, right? I do just fine with that. But there are certain foods that do cause, some stomach problems, right? With people who have peptic ulcer disease. And some people with ulcers don't experience any symptoms at all, right? Some signs of an ulcer can include gnawing or burning pain in the middle or upper stomach between meals, or sometimes really, especially at night. Pain that temporarily disappears when someone eats something or takes an antacid. They could have bloating, heartburn, nausea. In some cases, symptoms could include dark or black stool, and this is due to bleeding, right? That's something we have them look out for. It could include vomiting, and if it's vomiting, coffee ground material, again, that's bleeding in their abdominal wall or in the stomach, right? It could include weight loss, severe pain in their mid to upper abdomen. Drugs used in treatment of ulcers. We have H2 antagonists. They help decrease gastric acid secretion by reversibly binding to the H2 receptors or the histamine receptors located on the gastric parietal cells. And as a result, they inhibit the binding and activity of the endogenous histamine, right? So an H2 blocker thus functions as competitive antagonists. They block the release of hydrochloric acid in response to gastrin. And these H2 or histamine 2 antagonists are also used to prevent and manage allergic reaction in patients by decreasing or minimizing hives and pruritus that happens in the body, right? The antacid acts by neutralizing the acid in the stomach and by inhibiting pepsin, which is the prolytic enzyme, right? Each of these cationic salts has a characteristic pharmacological property that determines its clinical use. They do this because these chemicals are antacids or bases. They're bases, right? They're alkaline. So a reaction between an acid and a base is called neutralization, right? So this neutralization makes the stomach contents less corrosive. In peptic ulcer disease, antacids present a therapeutic effect by neutralizing gastric acid and by reducing acid delivery to the duodenum. Furthermore, they reduce the activity of pepsin and have the capability or capacity to bind to bile acids. Antacids can reduce gastroduodenal acidity for long periods if taken in substantial quantities after food. Intensive antacid therapy appears effective in healing duodenal ulcers and from preventing hemorrhage from these stress ulcers. Prostaglandins are found in high concentration in the gastric mucosa and gastric juices, right? And prostaglandins are important in the pathology of peptic ulcer disease and possibly in its prevention and treatment as well. Prostaglandins have been shown to inhibit gastric secretion. They've been shown to stimulate mucus and bicarb secretion, as well as increase gastric blood volume and protect against a wide variety of agents which cause mucosal damage. Here's a picture of where each of these medications work in the body. Pause the video and take a look. Antacids neutralize existing stomach acid and can provide rapid pain relief. Side effects can include constipation or, ironically, diarrhea, depending on the amount and the main ingredients in it. Antacids can provide symptom relief, but generally aren't used to heal ulcers. These medications protect the lining of the stomach as well as the small intestines. Antacids may ease symptoms for a short time, but they don't treat the ulcers themselves. Some precautions when taking an antacid include being careful when taking other medications, as they can keep them from working by blocking their absorption. So remember, at least 2 hours before or after any meds, right? Antacids can affect how well other medications work. So again, minimum of 2 hours, maybe even preferably of 4. Don't take any meds, right? Drinking alcohol as well while taking antacids can irritate the stomach and make symptoms much, much worse. Some side effects of liquid antacids might include nausea, constipation, could be diarrhea, headaches may occur. If any of these effects last or get worse, then we need to tell our patients to let their provider know immediately, right? The magnesium in these products can cause diarrhea, so it's important to be aware of that. One potential downside of long-term heavy use is that the medication could put the patient at increased risk for osteoporosis. Magnesium antacids can also disrupt the electrolyte imbalance of people who have chronic kidney disease, right? Renal failure patients. Improper balance of electrolytes like sodium, potassium, magnesium are one of the dangerous effects of chronic kidney disease, right? And antacid use can make this imbalance even worse. Therefore, chronic kidney disease patients should not use antacids. Electrolyte levels need to be checked too to ensure they are within normal ranges, right? Some side effects of taking antacids, remember, you can get that rebound acidity, so you got to be extremely careful, especially if patients are taking a lot of antacids, right? And then stop them abruptly, so be very careful of that. Again, could cause constipation or diarrhea, and it is not unusual for them to turn your stools white, right? So we got to educate patients about that as well. And again, the biggest drug-to-drug interaction is when patients take them too close to other medications and they interrupt and affect the absorption of those meds. All right, next we're going to talk about antiemetic. So antiemetics, right, are the most common and most uncomfortable complaints of side effects from our patient is nausea and or vomiting, right? And vomiting is a complex reflex within the body that responds to other various stimuli that are occurring, right? And in some cases, it really may be the desire for the patient to vomit, right? To induce vomiting. But many times, vomiting is not beneficial, right? And so we want to prohibit it in some cases. So how do we do that? How do we manage nausea and or vomiting, right? We give antiemetics, right? Antiemetics is what I should say. We give antiemetics. Antiemetics will help decrease or prevent vomiting, right? And it lowers nausea as well. Antiemetics work centrally. Many of them work centrally, or they could work locally, and they have varying degrees of effectiveness, right? We have different ones. We are going to talk about it on the next couple of slides. Then, when we do want to induce vomiting, we do have emetics, which will cause your patient to vomit, right? And way back in the day, when somebody would swallow something at home, and would have an overdose, the poison control centers would have patients induce vomiting. They no longer do that. It's not safe. So it's important to know. Okay, so here is the site where antiemetics as well as emetics work in the body. So pause the video and look through these so you can get an idea of where and how these work. Okay, so this slide is, we're going to look specifically at receptor blockers or serotonin antagonists. So these literally block the receptors that are associated with nausea and or vomiting, right? Primarily in the gut and the central nervous system, right? So we're looking at Zofran or ondansetron. That's the big one, right, for block 1. Those others on there you don't need to worry about, right? We're also going to look at 5-HT3 receptor blockers, right? And again, it's another medication used for nausea and or vomiting. And the 5-HT3 receptor blockers are rapidly absorbed. They are metabolized in the liver and are excreted through the feces and urine. They're really great for reducing that nausea and or vomiting response. They can cause side effects like headaches and constipation, and rarely drowsiness. Adversely, they can cause neurotoxicity in a small percentage of patients, right? And only with really large doses. Here is a breakdown of ondansetron, a 5-HT3 receptor blocker, right? Again, we give ondansetron, an antiemetic for patients who have problems with severe nausea and or vomiting. And it could be due to many, many things, right? It could be simply because they're on an opioid, right? And opioids tend to cause nausea in many patients. So we may give ondansetron or Zofran for that. Or maybe the patient's getting chemotherapy and or radiation therapy, right? And the side effect of chemotherapy and radiation therapy is sometimes nausea. Maybe postoperative pain causes nausea, most definitely, so we may give it postoperatively, and so forth. It's used a lot, right, in medicine. So, okay, great. This is the end of this section.